Hi guys, I'm Ria from Physioverse. Welcome to the lecture series of Physioverse. So, in the lecture series, we will be taking topics and teaching them to you in detail. So, it could be medical conditions with their physiotherapy management, or it could be physiotherapy practices. So, for the very first lecture series, we have selected the topic as stroke, because when we asked for your suggestions, most of y'all wrote back saying that y'all want us to teach stroke. So, here it is, we'll be starting with stroke. I think one of the main reasons why students struggle so much with stroke is because it's such a vast topic and it's an extremely important topic. Right from the exam point of view, be it theory or practical or even clinically, we deal very closely with treating stroke patients. So it's a very important topic, and stroke is such a vast topic that students usually struggle with learning and coping up with it. And even if it is taught by the best teachers in colleges, usually I have seen that the best teachers are allotted for teaching stroke, but they have to teach it in a very short amount of time, or they have to teach it for a very long amount of time. So if the stroke starts in probably first month of the year, it goes on till the mid-year. So by the time the students are in the end of the chapter, they have completely forgotten what they studied in the beginning. Or if it is taught in a very short amount of time, students are not able to cope up or understand it immediately. And another major problem that happens when we are studying stroke is that teachers, when they teach us stroke, they expect that we remember the basic neuroanatomy of the brain and its blood supply also. So that doesn't happen. We tend to forget because we usually study the neuroanatomy when we are in first year, and we have to study stroke properly in the final year. So in between the span of 3 years, we tend to forget our basics a little, and that's where the problem happens. When you suddenly jump to the condition and you're trying to learn and you don't remember the basics, then it's really difficult to understand the condition. So I have a tip for the students. Before beginning stroke, always go back and read about the neuroanatomy, read the structure and function of the brain along with its blood supply. So if you're clear with these two things, you will be able to know most of stroke properly, because that's all it is, to understand which area is affected and what functions are affected. Like depending on which area the stroke is, what symptoms the patient will present, you won't have to mug that up. If you know that the ACS supplies certain areas and these areas have so and so functions, immediately you know when it is this stroke, these symptoms will show up. So let's begin with the stroke series. Since this is the first lecture of the stroke series, it's going to be more of an introductory lecture where we will be going through the definition of stroke, its epidemiology, its risk factors, and the warning signs. Since this is an introductory lecture, it might be slightly general. So you might know most of the things that we mention in this lecture. But don't worry, as we move forward, we will go in more details of the chapter. So let's begin with the definition of stroke. Stroke is defined as sudden loss of neurological function caused by interruption of blood flow to the brain. So it's a very basic definition which tells us that when the blood flow to the brain is affected, there is sudden loss of neurological function. So what are these neurological functions? We all know that the brain does a lot of functions, like it has cognitive function like thinking, understanding, judgment. All this is done by the brain. Then it has sensory functions. All the sensations that we experience are perceived and understood by the brain. Then it has motor functions like moving your arms, your legs, walking. All this is controlled by the brain. Balance is controlled by the brain. Coordination is controlled by the brain. Even speech is controlled by the brain. So like this, the brain has a lot of functions. So to do all these functions effectively, the brain needs a constant blood supply through which it gets its oxygen, its glucose. All the energy to do these functions is derived from the blood. So if the brain is a very sensitive organ like that, if it does not get an adequate blood supply on a regular basis, the neurons or the cells in the brain start getting affected. And if it happens for a certain long amount of time, then the cells or the structures of the brain, they begin to die. And depending on the area where this happens, we see symptoms. So this could happen if there is a clot in the artery which is supplying the brain, or if there is a bleed of the artery which is supplying the brain. So depending on the area where this happens, different areas in the brain control different functions. So depending on the area, people could experience different symptoms. Some people might have difficulty in moving their arms or legs. Some people might have difficulty in swallowing. Some people might have difficulty in talking. Some people might have loss of sensations. So depending on the areas, their symptoms will also vary. So this is what essentially happens in stroke. If the blood supply to the brain is affected, depending on the area where this happens, the cells in the brain, they begin to die, and the more longer this happens, the more severe it gets, and depending on the area, we start seeing different symptoms. Also, to be classified as stroke, these neurological symptoms should last for more than 24 hours. Then only it can be called a stroke. If these symptoms last for 24 hours only, or they get resolved within 24 hours, then it is called transient ischemic attack, TIA, which we will be seeing in the upcoming lectures. So, coming to the epidemiology of stroke. Stroke is the second leading cause of death worldwide. According to the Global Burden of Disease 2016, 1 in 4 people will be affected by stroke over their lifetime. The annual mortality rate of stroke is 5.5 millions. Also, stroke is the third leading cause of disability worldwide. Of all the people who survive stroke, 50% of them are chronically disabled after the stroke. Let's move on to the risk factors for stroke. So risk factors are factors or variables which, if present, make a person more prone to having that condition, more susceptible to having or developing that condition. So a risk factor necessarily does not mean the cause of the disease. So please do not confuse a risk factor with the cause. So most of the risk factors for stroke are common with the risk factors for other cardiovascular diseases also. And generally, risk factors are divided into two, that is non-modifiable risk factors and modifiable risk factors. So as the name suggests, modifiable risk factors are factors which we can alter and change, and non-modifiable risk factors are factors which we cannot change or do anything about, like age, gender, ethnicity, genetic composition, etc. So let's begin with the non-modifiable risk factors for stroke. So one of the non-modifiable risk factors is age. As the age increases, the chances of getting stroke also increases. Especially after the age of 55, the chances of getting stroke is doubled every decade. It is believed that age is a risk factor for stroke because as we age, the time span for which we get exposed to other risk factors also increases. This contributes as age being a risk factor for stroke. The next non-modifiable risk factor is gender. So generally, men are at a higher risk of having a stroke compared to the women of their age. But as we age, this gets reversed. Especially above the age of 85, women are at a higher risk of having a stroke compared to the men of their age. Another non-modifiable risk factor for stroke is family history. If a person has someone in their family who has had a stroke, they are also at a higher risk of having a stroke. The next non-modifiable risk factor is ethnicity. It is seen that some ethnicities or some races are more predisposed to having a stroke compared to other ethnicities. It is seen that Africans, Hispanics and Asians are at a higher risk of having a stroke compared to Americans and Europeans. This is also affected by other risk factors such as their predisposition to having cardiac conditions or hypertension, their lifestyle and eating habits. So all this gets affected by other risk factors also. Another non-modifiable risk factor is genetic composition. So moving on to the modifiable risk factors of stroke. So modifiable risk factors are factors which we can alter or change. One of the leading modifiable risk factors for stroke is hypertension. People with hypertension are 3 or 4 times more at risk of having a stroke compared to people who do not have hypertension. Other conditions which put people at a risk of having a stroke are conditions like diabetes mellitus, and kidney diseases like chronic kidney disease also increase the risk of having a stroke. History of heart conditions like endocarditis, congestive heart disease, rheumatic valvular heart disease, and history of cardiac surgeries like CABG also puts you at a higher risk of having a stroke. Atrial fibrillation is also one of the risk factors for stroke. Sleep apnea is one of the independent risk factors for stroke. Increased cholesterol levels, especially increased LDL levels, also put you at a higher risk of having a stroke. Other behavior and lifestyle related risk factors for stroke are alcohol consumption, smoking, substance abuse, lack of physical activity, obesity, stress, and poor diet. Some of the risk factors for stroke are specific to women, like women in their early menopause before the age of 42, or women who have given birth or who are pregnant. Also, women who are taking hormonal therapy like progesterone or estrogen are at a higher risk of having a stroke. Also, preeclampsia is an independent risk factor for stroke. According to evidence, 10 modifiable risk factors such as hypertension, history of heart disease, diabetes mellitus, increased cholesterol, obesity, stress, lack of physical activity, poor diet, current smoking, and alcohol consumption are 10 risk factors which contribute to the 90% of stroke cases. So 10 of the modifiable risk factors contributing to 90% of stroke cases indicates that stroke is a highly preventable disease. So if we make the appropriate changes like increasing physical activity, having a proper diet, reducing smoking, alcohol consumption, reducing stress, taking proper medications for all the existing conditions like hypertension or diabetes we have, then we can reduce the risk of having a stroke also. So moving on to the warning signs of stroke. So warning signs are signs if present or identified in a person could indicate that they are having a stroke. So let's start with the warning signs. There are essentially 5 warning signs. The first one is sudden numbness or weakness of face, arms or legs, especially on one side of the body. The second one is sudden confusion or difficulty in speaking or understanding. The third one is sudden trouble in seeing from one eye or both the eyes. The fourth one is sudden trouble in walking, dizziness or loss of balance or coordination. The fifth one is sudden severe headache with no known particular cause. So these are the 5 main warning signs for stroke. So if anybody experiences this, it could be possible that they are having a stroke. There is an acronym for remembering these warning signs, that is BEFAST, in which B stands for balance. So if the patient has loss of balance or loss of coordination, equilibrium, if they are feeling dizzy or having a headache, it could be a sign of stroke. The next is E, which stands for eyes. So if there is loss of vision or they are not able to see clearly from one eye or both the eyes, it could be a sign of stroke. The next is FAST, in which F stands for face. So to check this, you have to ask the person to smile. If their smile is not symmetrical or same on both the sides, like if the face is pulling to one side and falling on one side, then it could be a sign of stroke. The next is A, which stands for arms. So to check this, you have to ask the person to lift both their arms in front of you. If they are not able to lift one arm, or if one arm tends to droop or fall down, it could be a sign of stroke. The next is S, which stands for speech. So to check this, you have to say a simple phrase and ask them to repeat after you. If they are not able to repeat that phrase, or if they are not understanding what they are saying, or if their speech is slurred or altered, it could be a sign of stroke. The last is T, which stands for time. So time is brain. In stroke, every second counts. So you should call for an ambulance or go to a hospital immediately once you identify these signs. Do not wait for these signs to get worse. Once you identify them, immediately go to the hospital. So always remember, be fast. B stands for balance, E stands for eyes, F stands for face, A stands for arms, S stands for speech, and T stands for time. So, if anyone is experiencing these warning signs like sudden headache, difficulty in speaking or understanding, sudden inability in moving arms or legs or face, especially on one side, loss of sensations on one side of the body, if they are not able to see clearly, maintain balance, then it could be the warning signs of stroke and they should immediately act on it. They should be immediately taken to the hospital or called for an ambulance. It is believed that there is an increased burden of stroke cases also because there is a lack of recognition of the warning signs among the people. People are not aware of these warning signs, so they are not able to recognize them at the right time and take the patients to the hospital to get the appropriate treatment. And because of that, they do not recognize these signs, and when it gets really severe, when the patients are not able to move or they faint or they fall, that is the time that they are taken to the hospital. By that time, the extent of the condition is even more graver than what it was before. So if we educate people better about these warning signs, and if they are able to recognize them earlier and go to the hospital earlier, they will definitely have a better recovery and prognosis, and the extent of the condition won't be as severe as it will be later. Because in stroke, every second counts. The sooner we identify these signs and report to the hospital, the faster they get checked and they get proper adequate treatment for that, the better their prognosis and recovery will be. And more time that they take to reach the hospital, if we do not recognize these warning signs at the right time, or if we reach the hospital even a little late, chances could be that the extent of the severity or the extent of the condition could be more severe or graver than what it would have been if we would have gone before. So it is very important to recognize these warning signs, to be educated about these warning signs and go to the hospital at the right time and get the treatment at the right time. So please spread proper awareness regarding these warning signs. So here we are at the end of the introductory lecture for stroke. I just want to tell all the students that don't ignore these parts of the chapter or this information, this knowledge that we are getting, just because we generally think that for our symptoms or PT management, studying all that in detail and practicing all that is far more important than all these parts. We just skim through this or read this for information or to when it is asked in exam once in a while. But don't look at it from that point of view. The fact that you have access to so much knowledge and you are getting to learn so much knowledge through your curriculum gives you so much power. If we spread the right information like about the risk factors or the warning signs, we can reduce the risk of people having stroke also, because we have seen that there is not awareness among the people regarding these warning signs or risk factors. But if we spread the correct awareness and people implement this, we can potentially reduce the risk of stroke cases. I also want to thank all of y'all who are supporting Physioverse, because it means so much to us. Please let us know if you like something, if you don't like something. Let us know if you want anything more to be added to the topics of this lecture, what you want us to know in the next lecture. Then if you've liked this video and you want us to do more content like this, please go subscribe to our YouTube channel, follow us on Instagram. Let us know what you want us to teach in more detail. Please keep giving us feedback, what you would like us to change or add in our videos, what you would like us to remove. Let us know all of that and we will try to deliver our best. Thank you.